Dr. Stanley Lang, and welcome to this short video on see this is not going to be exhaustive. So had been to the emergency room, was in for follow-up, and so I asked him whether he was still taking his vitamin K2, which we had started a while ago, and he kind of sheepishly said that he'd stopped it about 6 months before. And so the answer to the question, when does vitamin K2 not work? And the answer is when you don't take it. And so a lot of people have heard about vitamin K2 and its value in helping the bones. It's critical in terms of having bone health. It's also been well documented as a major role in decreasing the risk of heart disease. Studies in both men and women show a dramatic decrease in coronary artery disease events. And the reason is because it helps to prevent soft tissue calcification, so it helps to prevent calcification in the arteries. And the way it does that is by activating a protein called the matrix GLA protein. Well, this protein is present in a lot of other soft tissue. In fact, it's present wherever there are little cells called fibroblasts, which are scattered all over the body. And fibroblasts secrete this protein. Now, there's a lot of genetic variations, and that's why there are some genetic tendencies in developing kidney stones. However, what is interesting is that kidney stone frequency has been going up for quite a long time, and genetics haven't changed that much. So what's going on? Well, it could be that vitamin K2 deficiency, which is already bad, is getting worse. That's a possibility. Nobody's tracking it. But it also could be that the genetic expression of the matrix GLA protein is changing because of the assault that we have had on the expression of our genes. And what is that assault coming from? It's coming from a messed up biome. So when you have a bunch of junk coming into your gut that damages your biome, which is a word that describes the bacteria and fungi that live in your gut and the delicate balance that's supposed to be there, when you're messing that up, you're going to mess up the genetic expression of lots of different things in the body, and something that's not being tracked is, well, what does this do to expression of kidney disease? Well, probably there's a connection, but as I said, nobody knows for sure. But we do know that the matrix GLA protein has a lot of variants. And so if you have a genetic expression change because of one of these variants, that's going to affect your risk of getting kidney stones. So the first thing you can do to decrease kidney stones related to vitamin K2 is to eat as clean as possible so that you're not messing up your biome. So because the matrix GLA protein is what is stimulated by the vitamin K2. It's activated. And when it's activated, then it helps to suppress kidney stone formation. The second thing you need to have relative to this part of kidney stones is enough vitamin K2. Now, vitamin K2 is a complex vitamin. It's got at least 9 different subtypes, probably more. And we know that 2 of the subtypes can be currently supplemented. Most of the time, people are only taking the subtype that's called MK7. Now, MK7 is not the most active form of vitamin K2 in the kidneys. It's MK4, which is also the most active form in the brain. So I recommend to my patients that they supplement with both of these forms. And I think it's critical to supplement because the food sources in the United States are unreliable. Unfortunately, I like to get vitamins into my patients using food sources whenever possible. And I used to tell patients you could get all the vitamin K2 that you need from food, which theoretically is possible. But it's not likely to happen in the United States at this time because of what's happened to the food supply. And I won't go into the details, just to say I strongly encourage that you supplement with a high quality vitamin K2 that's got both MK4 and MK7 in it if you want to decrease your risk of kidney stones. Now, if you don't care about decreasing your risk of kidney stones, if you want to decrease your risk of heart disease, how about that for a reason? And if you want to decrease your risk of osteoporosis. So these are some good reasons to have very good levels of vitamin K2. So what's the number needed to treat as far as effective vitamin K2 supplementation and decreasing a heart attack? So the number needed to treat is 2. So in other words, if you treat two people who had low vitamin K2 levels with vitamin K2, the decrease in heart attack risk happens in 1 out of those 2 people. So what's the number needed to treat for a statin drug in somebody that doesn't have active coronary disease? Well, it's somewhere between 1 in 150 and 1 in 250. So that's the context in terms of the power of vitamin K2 to decrease the risk of heart disease. So back to the kidney stone question. The reason that kidney stones happen most of the time is calcium oxalate, which crystallizes together. Obviously, calcium is part of that. So the matrix GLA protein, when it's activated, suppresses calcium crystallizing into anything when it's in your body. And so it circulates around, but it's also inside the cells. So it has a lot of effects that we don't know about yet. And so we can speculate that it has a powerful effect in kidney stone protection. Now, I can't tell you that there's any research that proves the connection between vitamin K2 and kidney stone reduction. However, there is a lot of research that shows that there are relationships between the things that are connected to vitamin K2 deficiency and kidney stones. In other words, these other things that, if they're present, that are linked to vitamin K2 deficiency are also linked to kidney stones. So you can't hurt yourself by taking K2 supplements if they're high quality. I recommend being very careful about Chinese sources for reasons I won't get into. Because the reason you can't hurt yourself, as I already alluded to, it helps your heart disease risk and it helps your osteoporosis risk. So whether you're a man or woman, you've got a high risk of one of those 2 things. So I hope this has been helpful to you. I wish you well, God bless, and have a great day.